Arti Mahla, consultant gynecologist, Manipal Hospital Jaipur. Today we are going to discuss a very important female health issue. It is important because this is very common, very less understood, and this is very dangerous actually. And why it's important? Because if we know, we can manage it. And friends, this is PCOD or PCOS if it's more complicated. Sometimes we call it PCOS also. This is Polycystic Ovarian Disease. The disease everybody of us must have understood, must have heard PCOD, but only some of us know something about this. But very few of us know exactly what is the problem. So this is very common condition. 1 of every 5 female is suffering from this disease. So disease load is too much, and basis is actually genetic, but it is complicated by our poor lifestyle. Pathogenesis starts around menarche, that is the age where menses begin, but mostly symptoms appear in their 20s and 30s, but complications and dangers are further life. So we need to understand what are the common complications and what are the higher dangers of the disease. Commonly patient presents to us with delayed periods, infertility, and prolonged and heavy menstrual bleeding episodes, and sometimes this can lead to endometrial cancers also. So basically this is androgen excess and insulin resistance. This is the basic pathological conditions which are the culprit and which are responsible for all the symptoms and risk of the disease. And while managing, we need to focus on these two problems only. This is androgen excess and insulin resistance. Androgen is male hormone. If it is more than normal in a female body, this leads to defect in ovulation process, and androgen levels are more and estrogen levels are sometimes more and sometimes normal, but progesterone levels are most of the time less than normal, which leads to unopposed estrogenic bleeding and prolonged episodes of bleeding and infertility and increased chances of endometrial cancers. And insulin resistance, this is because of more of sugar and more of insulin levels in your body. And while managing, we need to minimize our insulin levels and sugar levels to control the disease. And if we talk about the dangerous conditions which very few of us know, they are like increased chances of blood pressure, your cholesterol levels are deranged, and there are chances of diabetes mellitus. People who are having family history of diabetes in parents and elderly brothers sisters, they also have more chances of having this PCOD. And every PCOD patients, they have more chances of getting diabetes in their later lives, and when they are pregnant, they also have increased chances of developing gestational or pregnancy induced diabetes. And apart from hypertension, cholesterol dysfunction, and your diabetes, you are having more chances of developing weight gain, obesity, and further complication like sleep apnea because of excessive weight, and depression and mood disorders, lack of sleep disorders, and cardiac risk are also there, and thromboembolic process is also deranged, and this can lead to stroke also. So these are very well known factors, but they are very less known to public. So we should know what are the complications and how can we improve, or how can we manage if once you have diagnosed of PCOD. So we need to focus on these two things. Our androgen levels should be minimized, and our insulin and sugar levels are to be minimized. For that, the only solution is improving your lifestyle. By lifestyle, regular exercise, walk, more of aerobic exercises and yoga and breathing exercises, your hormonal imbalance will be corrected, your fat tissue will be minimized, and your androgen levels will also minimized. The androgen levels in your body, they are in proportion to the fat tissue in your body. So when fat tissue is minimized, your androgen levels are also minimized. Sometimes we give some oral contraceptive hormonal treatments also for this regulation, but lifestyle is the most important thing. And about your diet, you have to take less of carbohydrate and less of fat, less refined carbohydrate and more of protein and more of fibers, and highly unprocessed food should be definitely avoided, and minimally processed food is the best food for your PCOD problem. So lifestyle is the only solution for this, and this is the basic purpose to tell you about the what are the conditions, what is the basic pathology, and what are the risks and what are the solutions. So solution lies in the lifestyle only, and you have to go for regular checkup, and your doctor will prescribe you medicine for your insulin resistance, which will help you for reducing weight. And but lifestyle changes you cannot compromise. No medicine can replace your lifestyle changes, and these are supportive medicine, some oral contraceptive hormones and some insulin sensitizing agents, and something for weight reduction we can give you. But this is a metabolic condition, and this is the most complicated hormonal disorder, but we can manage it if we know it. Thank you.